People pointed out lifestyle diseases. Here, the Minister of Health should really educate these Ugandans, educate all of us. Because even some of us who are very health conscious, you find we don't know. Like, for instance, when this corona started, because me, I don't have budget for sickness. To have days when I am sick and the legs are up in the hospital, I don't have that budget. I have been active for the last 60 years, almost continuously. I think I have only been down with malaria, actually, only 2 times in these 60 years. Because I've got work to do, and I can't do it when I'm sick. I've got a mission to do. But when this corona started, I was watching, I think it was BBC, and then I saw, they were wondering why many people are dying in Europe from corona. And one of the doctors pointed at vitamin D, that because in Europe there's not enough sunshine and people are indoors, they don't get enough sun, they don't have enough vitamin D. And apparently vitamin D is very crucial for the immunity. So, out of curiosity, I called my people, you come and check my vitamin D. It was down. I had very low vitamin D. There's another one called vitamin B12 or something like that. And all those are part of the barracks to fight the enemy. And yet mine were down, not because I didn't have the capacity to have them, but because I didn't know. And I no longer go to the sun. I go from the house to the car. I no longer expose myself to the sun. I'm like the ones in Europe who have no sun. So I had to sort that one out. And so now you wonder, why wouldn't our medical people identify all these things that one needs to do and tell us like, every 2 weeks, go on the radio, this DHO. Do you know somebody called DHO? Have you heard of him? He's called a district health officer. So why doesn't this DHO tell us? Every 2 weeks, you just go and tell you people, in order to do this, you do this. People just do it at their own cost. Now, like this, eating too much, then people get fat, and then the arteries get clogged. Then they die, they collapse, then the ambulance. All this can be prevented. Tell us how we should eat. What is the best way to eat and when? Alcohol does a lot of damage also to people. So, as we talk about the ambulance service, you have heard, Ayume has made a very good case that you may have the ambulances, but you may not manage the cost. Because 200 liters of fuel from here to Karanga and back, or is it only going? Huh? Is it only going or coming also? Two ways. Or query. 200. Honorable Dr. Ayume made a very good speech. He was part of my health group before he deserted to become a member of parliament. He pointed out what I have pointed out many times. Why doesn't the Minister of Health emphasize prevention rather than cure? Because as he pointed out, all those ambulance needs are preventable. So the Prime Minister is not here, but my staff are here. They should tell the Prime Minister and remind me that this road carnage must stop. We can't go on doing stupid things. People kill themselves, then we lift them, then in kama mambo ya ujinga. Why do you drive recklessly? Why? So all those policies, including forcing car owners to put speed governors in their vehicles at their own cost, all those should be exhausted, all that line of ensuring that people drive carefully and they don't kill themselves, and in the process give us all this big burden of having to waste resources to look after people who are careless with their lives. And then as
introduce the other one.
So the other one is a type B, which is a basic life support ambulance. So it has a dual purpose for this situation. It's able to support vaccination to the hard-to-reach islands, but also it's able to carry patients who are not severe that need basic treatment, like a little oxygen and to lie flat during transfer. So it's equipped with medical teams, as you can see that too. And then they are both nurses.
those are not as important as you.
No, they are very important. And a first aid kit, so that in the event that there's a patient who is not very sick, they can transport them. If they are very sick, they call this one.
Okay. Okay. Apoyo. Apoyo teach. Where did you study, Aleno?